Did you know that Black women in the United States are more likely to die giving birth than any other race? Sorry. So if you answer yes, then this information will not be new to you. If you answer no, together we're going to unpack some of the leading contributing factors to the increase of Black maternal mortality rate. So I haven't only been interested in this topic from an academic standpoint, but also from a personal standpoint. I'm Black, I'm a woman. One day I plan on starting a family, and I don't want the color of my skin to dictate the type of treatment I receive. And not only the type of treatment I receive during my pregnancy, but also the type of treatment I receive during labor and delivery, and the type of treatment that I receive during postpartum care, which is very, very important. So, some of the leading contributing factors is structural racism. We have pre-existing medical conditions such as cardiovascular disease, diabetes, and hypertension. We also have access to affordable healthcare, which is very, very important as well. Most of my sources came from the Sage Journal or from Women in Health magazines. I did find a couple that were very, very, very interesting. Like the first one, this is from a midwife perspective, and it's just basically explaining that if we had more Black midwives, then this could possibly be the catalyst to dismantle or to start seeing a decrease in Black maternal mortality rate. This midwife believed that Black women feel more comfortable with a Black provider because they provide a level of, not only a level of support, but you just feel more comfortable around someone that gets you, someone that would take your pain into consideration, someone that looks like you, that might not have personal experiences, but in the back of their mind, they're taking every one of your health concerns into consideration. And this is not saying that any other race or providers doesn't take your pain into consideration, but this particular midwife believed that if we had more Black providers, then we would start to see a shift in the Black maternal mortality rate. So, as previously mentioned, with structural racism, I'm not sure if you guys are familiar with redlining or zoning. I believe this was back in like the 50s and 60s when African Americans would go to the bank to apply for a loan to buy a home, and they were denied, which then forced them into impoverished neighborhoods. And within these impoverished neighborhoods come food deserts. And not only food deserts, but access to healthcare. So with food deserts, there's probably only maybe one grocery store and like a 20-mile radius. And if you're in Buffalo and you're in like the downtown area or the Fruitville area, you know that on every street corner, there's a corner store. And what do corner stores sell? Pop, candy, chips, which in fact leads to cardiovascular disease, diabetes, hypertension. So they believe that structural racism also played a part in the increase of Black maternal mortality rate. I also have a source from a Women's in Health article in Sage Journal, and it's just the examination of the maternal near miss. So maternal near miss is basically, it could have been fatal. It could have resulted in maternal mortality. And they just conducted a research from 12 women, 12 Black women, about their experience during labor and delivery. And most of the women said they felt like their health concerns were either dismissed, disregarded, or there was a miscommunication with their provider, and they just felt stressed during their labor and delivery. And this could have resulted in a in a maternal mortality rate. I found this particular article interesting because it mentioned Dr. Shalom Irving. I really hope I'm saying her name right. She was an epidemiologist that worked for the CDC, and she was a Black woman that passed away 3 weeks after giving birth. Now, 3 weeks prior, she had noticed that her lower extremities had swelled. She noticed that she had these headaches that she just couldn't get rid of. She noticed that she had a low urine output. But every time Dr. Irving went to the ER, they dismissed her. And sadly, 3 weeks after giving birth, she passed away due to a heart attack. Now, if you're not familiar with some of her conditions or some of her symptoms, they showed symptoms of not preeclampsia because she wasn't pregnant. They showed symptoms of eclampsia. But they went unnoticed or disregarded. And I believe it's because she was Black. But which was very interesting is that she had a PhD. She was conducting research with the CDC and not seeing that being educated dictates your healthcare. But being a Black educated woman, she still succumbed to racial biases, which isn't right, which isn't fair. Everyone should get the proper treatment regardless of your skin color. In my next source, Strengthening the Postpartum Transition, which also ties into Dr. Irving's story, but then it also talks about Serena Williams. And I'm pretty sure everyone's familiar with Serena Williams, the famous tennis player. She had to self-advocate for herself after giving birth. So there's a gap between your OBGYN and your PCP, your primary care physician, your primary care provider. OBGYNs, we all know they're involved in like the labor and delivery process. But after you give birth, you're transitioned to your PCP. But this article states how they need to bridge that gap because with Serena Williams, after she gave birth, she noticed that she was out of breath. Now, you don't go to see your OBGYN, you go to see your primary care physician, which I'm not a medical expert, but it's just for overall health for your primary care as opposed to your OBGYN who's for vaginal health. But she had a C-section and she noticed that she was out of breath after her C-section. And, she went up to her nurse and she told her nurse, she's like, hey, listen, I'm not feeling well. I think I need a CT scan. Because previously to her, when she played tennis, she had the same condition where she had a pulmonary embolism in her lung. And she showed the same symptoms. She was out of breath. So she knew what she needed. So, she's telling her nurse, like, hey, I think I need a CT scan and I need to be started on a heparin drip. And the nurse is like, well, you just gave birth not too long ago. It could be a result of the C-section. Just take it easy. And she's like, no, this is what I need. So they ended up doing a CT scan and come to find out she did have a blood clot that could have led to being fatal. And this could have been another Black maternal mortality. So I just believe that including racial racial classes or implementing different inclusion, diversity in the schools, like universities, then maybe this can decrease the Black maternal mortality rate. I honestly have no no ideas of what can decrease this other than just seeing an individual as a person and not treating them based off the color of their skin. I also have one that I wanted to talk about. This is from another journal, and it's the Black White Disparities in Maternal Hospitals. And this article was just about how teaching hospitals versus non teaching hospitals contribute to the Black maternal mortality rate. And teaching hospitals is basically where you have like your medical students involved, and you have your medical students involved. I mean, your medical students involved, and you have your residents involved, and like the entire process of labor and delivery. So they had an increase in Black maternal mortality rate as opposed to the non-teaching hospitals. So that was another interesting article that I read or that I used in my research paper. But I really hope that if you're not familiar with this topic, you do more research on it. If you're going into the medical field, you just practice your ethics and morals, and you see a person as just a person, and not dictate their healthcare treatment by the color of their skin. Thank you.